Doctors are working on a new way to treat breast cancer without surgery.
Although the idea may seem counterintuitive, health editor Dr. Maria Simbra explains how doctors hope it could be a better option for a lot of patients.
When Deanne Whitley found a lump in her breast, she thought it was a cyst, since she's had clusters of cysts before.
Went to the doctors and was surprised when they asked me to stay.
Turns out it was more than a cyst. Deanne had breast cancer, a type called HER2 positive. She responded well to chemo and expected surgery next.
The removal of her breast, just the thought of that, it just, it's very difficult to imagine yourself. You feel like you're losing a part of yourself.
The standard of care at this point in time is that after their treatment is done, that surgery is performed.
But an unexpected option came up. Her doctor asked if she wanted to participate in research, the Exceptional Responders Trial. In this study, instead of getting surgery, patients are just carefully watched with scans.
And I said, what? You don't have to cut me?
There are many situations wherein women who receive chemotherapy have no evidence of breast cancer remaining in their breast.
With modern chemotherapy regimens for HER2 positive cancer, this happens for 6 out of 10 women, just like Deanne.
You have to wonder what the purpose of the operation was if there was really nothing to remove anymore.
In the study, at the end of chemotherapy, participants get repeat mammograms, ultrasounds, and sometimes an MRI scan to show there is no cancer left. Doctors also do a repeat biopsy to confirm. Study participants get mammograms and breast ultrasounds every 6 months for 5 years.
Most recurrences in breast cancer of this type happen within the first 5 years.
This multi-centered trial is looking for more women to take part in the study, 50 in all. To participate, their tumor must be HER2 positive and smaller than 3 centimeters. However, women younger than 40 are not eligible. As a safety measure, if the cancer comes back in any of the patients in the first year, the trial will be shut down.
If we can figure out with a small group of women that this is a feasible approach to breast cancer care, I anticipate that it will change practice and spur the idea of having a larger scale national clinical trial. I would love to see myself out of a job. I would love to be able to say that breast cancer surgery is not necessary for all types anymore.
Since Deanne is skipping surgery, she will go straight to radiation treatments. She understands she will need an operation if the cancer shows up on any of her future scans.
The only thing that can happen is that I need surgery, which was I was already slated for surgery. Things are going exceptionally well for me. I'm healthy, I'm working out, I'm eating right.
With a positive attitude and a solid support system, Deanne is ready to tackle her cancer with this unique, new watching and waiting approach. I'm Dr. Maria Simbra, KDKA News.